Right. Can you all see that then?
Yes, I can.
Good. Okay. So this is part 2 of the presentation on low carb lifestyle, and looking at setting some goals and some thoughts on how to approach the challenge. There we go. And as always, this is for information only. It's not medical advice, so please discuss any dietary changes with your doctor, especially if you're on medications to lower blood glucose or blood pressure. And if on medications, these practical guides where I've put the links in can be passed to your doctor. Okay, let's have a quick look. This is a catch-up, so quick look at the scale of the problem. Obesity rates, there are now 20 million in the UK in the obese category, which is up 4 million in the last 4 decades. And there are 5 million, almost 5 million, with diabetes, which is possibly a 10-fold increase from 1980. And 10% of NHS budget is spent on diabetes and its complications. You may have heard that figure before, and 1 in 6 patients in hospital have diabetes. But this other statistic, in 2007, there were 81,000 people who admitted to hospital where obesity was a factor. That's either a primary or a secondary cause, they say. And in 2019, that rose to an astonishing 1 million people. So there's a problem there. And the NHS management of type 2 diabetes, I've shown you the slide before. It doesn't have to be that way. Diabetes doesn't have to be a lifelong condition, but it will be if you follow the NHS advice, unfortunately. In previous presentations, I talked about insulin resistance. If you have type 2 diabetes, you will be insulin resistant, and certainly also probably have elevated insulin to begin with. So all these diseases and conditions that I've listed around this circle are not necessarily caused by insulin resistance or elevated insulin, but insulin resistance is present to some degree in all of them. So it's a very common condition. Change your diet and you can reverse the risk of insulin resistance and reduce the risk of chronic diseases. So I went through presentations about it's not your fault. So these are just sort of summary statements. You can't outrun a bad diet, but I should add the benefits of exercise are unbelievable. Your health will improve on exercise, even if you don't lose the weight. Processed food addiction is also a reason why that affect obesity and diabetes, and it's not your fault. Hunger and hormones as well. If you have an inner battle between willpower and hunger, hunger will eventually win. And lastly, stress levels and poor sleep can affect insulin resistance and weight gain.
Mike. Mike.
Yep. Okay, let's have a quick look at what to avoid and what to eat. And John mentioned it previously. Sugar, refined grains, seed oils, and everything in that picture. And eat real food, prioritize protein, control your carbs to your own tolerance level. Everyone's tolerance level can be different. And don't fear natural fats. Avoid the seed oils. Right. So what affects how much you eat? You'll overeat carbs and fat if you don't eat enough protein. and adequate protein is key to satiety. And these others I've already mentioned. Right, let's get on to the main part of this presentation. The important bit, steps to reversal and recovery. And you'll need to forgive me that I'm an engineer and I'm straying into the psychology of health and eating, but I hope you find it interesting and useful. This presentation's a little bit different. I gave this quotation at the end of my last presentation. It's your road and yours alone. Others may give you directions and walk it with you, but no one can walk it for you. Now that comes from a 13th century Persian poet and philosopher. So I thought I could use it as a metaphor to explain the road to reversal and recovery. It's a similar sentiment to one I've given before, which says, it's not your fault, but it is your problem. So let's look at all the things attached with this. Why am I on this journey? We'll explore each of the questions in some detail. And so think of them in terms to the road towards better health. So what's my destination? Is this the best route that I'm taking? Who can I trust for directions? Have I planned my route well and am I well prepared? Do I really have to walk alone? Can't someone give me a lift? And who is walking with me? Am I alone in this? And if my plan isn't working, I should change my plan and not my destination. So I'll go through each of these now with some more on it. So why am I on this journey? So you want to identify and try and understand why you're on this journey, and so perhaps you've been any of these. Myself, I have not had diabetes. I've had some of the symptoms and all those issues went away. So I have set myself goals and I try and stick to them. So thoughts that might relate to you is you've been diagnosed with type 2 diabetes or pre-diabetes. You're worried about the potential complications. Your GP says you'll be on medications for life. You may have heard that 30% of those with type 2 diabetes will eventually be taking insulin. And other reasons might be, some are calling Alzheimer's disease type 3 diabetes. Now I read that Sir Steve Redgrave, one of my Olympic heroes, he's a rower. I do a lot of indoor rowing myself. He's got type 2 diabetes. He says his greatest fear is losing his sight. But unfortunately, to the best of my knowledge, he's persisted with the NHS treatment plan and he still has diabetes. So what's my destination? Setting some goals. So your goals might be to put type 2 diabetes into drug-free remission. I'd suggest write the goals down, put it on a post-it note or something, stick it on the fridge so it's always there. And don't make your goal just to get a bit better, make your goal to get well. There's a difference there. So on this list here, reverse pre-diabetes, stop the blood glucose highs and lows, lose weight without hunger, improve your physical health in general. It's good to be a bit more specific and have a goal that is measurable and noticeable, or noticeable in some way. You might want to look at improving your mental health and mental ability as well. That's happened with me. So, or you want to improve a specific conditions. Many conditions can be improved with diet, from migraines to eczema to depression. I'll take a little aside there. A couple of months ago, I thought, oh, it'll be all right for me to start eating bread again. So I had 1 or 2 slices a day. My eczema came back. About 2 weeks ago, I gave up bread and my eczema's gone away again. So I don't think I'll be eating bread again. So what about the details on your destination? Some suggestions here. Set a date to stop snacking. Recognize unhealthy cycles. So, for example, a high-carb breakfast can lead to snacking later in the morning. Or, say, poor sleep leads to feeling low, leads to eating to relieve fatigue, leading to being overweight, maybe leading to sleep apnea, poor rest, and the cycle all goes around again. So you might want to recognize the trigger foods, those that if you start, you will definitely finish the package. And don't reward yourself with food. Don't say to yourself, I deserve it. Give up sweeteners, I would recommend. But these are some of the goals that you may set for yourself. You have to decide. Don't eat before going to bed. Another suggestion. Get exercise, walk more, get some sunlight, especially now we're getting some more sun in the sky now. And write down what we're grateful for on a daily basis, because it shifts your attention away from negativity and towards positivity. So record the wins that you're having. So what are the best routes that you might take? Medications, surgery, very low calorie shakes, intermittent fasting, or low carb. Now, oops, I think I've jumped. Let me just go back. Sorry, I've jumped 2 slides by mistake. So these are some deeper thoughts which come from Jordan Peterson, which some of you may have heard of. He's a clinical psychologist from Canada. So on achieving your goals, he says, think of the benefits of reaching your destination, your goals. Are there consequences of staying put, of inaction? Does inaction or doing nothing have a price, physically, emotionally, or even financially? What are the consequences of inaction, action or inaction on those close to you or those who might care for you? And does the action depend on you or does it depend on someone else? Anyway, those are some slightly deeper thoughts which perhaps you need to take time to consider. So getting onto the slide, the options, medications, which the NHS will offer you. Bariatric surgery does, for some who need it, reverse type 2 diabetes. It's been proven. Very low calorie shakes, intermittent fasting, and low carb. Those last 4 options are all included on the diabetes.co.uk website. And I'll just put the link there. And they evaluate these on their homepage. So if you want to, you can go and have a look at that. I won't talk about bariatric surgery and start with the very low calorie shakes. And the NHS promotes these through organizations such as Xyla Health, which, thank you, Brenda, for highlighting that last time. And they do a 12-month program, I believe, starting with 12 weeks of the low-calorie diet, shakes and soups only, followed by reintroducing food. These are their words. they say you will be reintroduced to food after taking these shakes. The implication is almost that the shakes and soups aren't food. So intermittent fasting, that might be like Michael Mosley's 5-2 diet, or maybe eating only 1 or 2 meals a day. Lastly, real food, low carb, following the suggested rules on protein, carbs, and fat that I mentioned earlier. Who should we trust? Who's going to give us directions in the right way? Maybe some GPs are enlightened, and when discussing your diabetes, they will first ask you what you're eating before reaching for the prescription pad. The NHS guidelines say that type 2 is a lifelong disease, so if you want to reverse your type 2, that and the Eat Well plate can't really be trusted to do that. And Diabetes UK is industry funded by food and pharmaceutical companies, and they essentially follow the NHS approach. So the remaining ones, which I've just highlighted in red font, Diet Doctor website, that's the largest low-carb website in the world. Diabetes.co.uk, which run the low-carb program, which many people have joined up and are having some success with. I think you do have to pay for it. People like David Unwin, who one can see on his YouTube channels and other guides that he gives. He's reversed type 2 in 114 of his patients so far using the low carb option. Low carb Freshwell is also run by an ambassador for the public health collaboration, as I am, but he knows what he's doing, this chap, Dr. David Oliver, and they have a website as well. So I've given links later on this one. And of course, people that I would trust is people like Professor Tim Noakes, but there's many others, but he was the one who set me on my path to much better health. And lastly, get informed and trust yourself to take your own directions. So planning all of this. I've suggested some thoughts on planning here. Discuss your plans and reasons with your family or household members. I think unless they're on board, success is unlikely. But maybe you can give some comments afterwards on that. And if you let them help you with your plan, there's more chance they'll support you. And there's a good chance that they'll benefit from joining you, even if they might not know it at the time. So set a start date, the sooner the better. Decide whether you want to do it all at once or gradually change. If you're on medications, talk to your GP. Tell them your intentions so that they can monitor a gradual program of de-prescribing medications. And of course, you may have already started and made many of these decisions. So a little bit more on the planning. Make a list of the foods to eat and the list of foods to avoid. I'll talk a bit more about that, hopefully in part 3 of these presentations. Start to get rid of processed food as well. And only buy food that's on your real food that's on your to eat list. Plan your cooking and eat at home as far as possible as well. And as I say, the practical details I'll go into a bit more in part 3. If if everybody wants to listen to part 3. So this one here, do I really have to walk? Can't someone give me a lift? You might be thinking, I'll just let my GP give me a prescription. In fact, many patients are actually disappointed if they leave the GP surgery without a prescription. They want a quick fix, but there are no quick and easy fixes. I'm not saying that medications are not necessary, but for someone newly diagnosed with type 2 diabetes, diet changes should be the first option. And we might say that changing lifestyle is too hard. Well, yes, it is hard. There are many temptations and hurdles in the way. Now, this next bullet point, before attempting to cure somebody, first ask if they're willing to give up what made them sick. That comes from Hippocrates, almost 2,500 years ago. And lastly, you can only take this journey if you trust that your destination will be healthier and is worth the sacrifice. And it does come with sacrifices. There is no more cake. And in my case, well, no more bread. So reversing diabetes is a slow process. Some can do it in a matter of weeks or months. Others might take a few years, and for others, it never quite happens. But that doesn't mean one shouldn't try. Getting halfway there will certainly reduce the risk of complications. So who's going to walk with me on this one? Who can give me support? And perhaps the best support is self-knowledge and learning about what is possible, what works for you. After all, it's your health, so invest the time in it. Family and close friends can give you support. They need to be supportive. And some families can manage with cooking different meals for different family members, but many are unwilling, and ordering takeaways isn't really the answer. I know my son and his wife, they have different meals. She is celiac, so she can't eat any gluten at all. But my son and the 2 kids, they can eat pasta and bread, and they do. But they manage to do all of that. So one can have 2 lots of meals cooked. Other programs for support, a few GP surgeries will be supportive, but unfortunately, not many will. And I've mentioned a few ones that one can look at. And of course, there's many low-carb cookbooks, and there's community programs exactly like this Thanet Diabetes Community Group, and suggestions on how to improve it and enhance it are always welcome. So I've included some links here, and I hope when John puts them up on the website, they're all going to work as well. So lastly, so if my plan isn't working, I should change my route, not my destination. So find a real food, low carb plan that works for you and amend it if needed. What works for you may not work for someone else. Knowing your blood sugars is often quite key on this one. So keep to real food, avoid processed food and all these others I've mentioned before. There's going to be pitfalls and relapses. So one needs to learn from them and keep a record of what works and what doesn't work. Lastly, pay attention to exercise, stress levels, and sleep. They're all important. And the very last slide. Dr. Sarah Hallberg, reversing type 2 diabetes starts with ignoring the guidelines. She gave a great TED talk on that one. It's had about 5 million views so far. Lifestyle changes are hard, she says. If it was easy, everyone would do it. So thank you. And I know this